Hello, my name is Louis Calderon, and this is my TED Talk presentation on why we should use nurse practitioners in the emergency department setting. I've worked in large academic hospitals, level 1 trauma centers that use nurse practitioners, and I have worked in many hospitals that do not use NPs in the ED. And this is something that we must change. More hospitals need to use NPs in the ED. So my name is Louis Calderon. I'm a registered nurse. I'm also a certified emergency nurse. And for this presentation, I'm an advanced practitioner registered nurse. I've been a nurse for over 15 years. I've worked in large level 1 trauma centers, as well as small community-based hospitals and emergency departments. I even worked as a flight nurse on a medevac helicopter. I was promoted up the ranks, and I'm currently serving as Director of Nursing for a mid-sized urban emergency department. My ED sees over 48,000 ED visits a year. I have over 120 employees within a 52-bedded emergency department. I also have a 9-bedded clinical decision unit. This is John. John is an 82-year-old male. He was cooking at home when he had his knife in his hand. He lost his balance. He dropped his knife. He fell to the floor, and he accidentally fell on his knife, where he stabbed himself in the substernal area of his body. He stabbed himself. When this happened, he let out the biggest scream you could imagine. Neighbors came running. They found him on the ground, knife impaled in his chest. 911 was called. Ambulances responded. They took him immediately to your emergency department. At that time, there was only 3 nurses working and 1 doctor. There was 42 patients in the emergency room. When the paramedics came in with John, there was no one to be found. There was no nurse available. There was no doctor available. "42-year-old Mike playing outside with his kids." 42-year-old Mike playing outside with his kids. He started to feel this chest pain, this ripping pain in his chest. He got sweaty like you didn't even imagine. He went to his kids. "I need help." His kids said, "Oh, Dad, you're just old." They made fun of him. He was sweating. They thought he was just playing too hard. He then collapsed to the ground. Thank God his children had a cell phone. They called 911. Paramedics arrived. They found him in cardiac arrest. They defibrillated him 1 time. They regained a pulse. Put him in the ambulance. They lost a pulse. CPR was started again. Unable to be defibrillated. Was not in a shockable rhythm. They brought him to your ED in full cardiac arrest. Not a doctor was free. Not a nurse was free. The medics continued to provide CPR while waiting for the ED team till they were so exhausted. Little Alexa playing soccer with her friends on a team. So happy she made this team. Playing so hard, chasing after the ball. She ran, she hit a little divot in the dirt. Twisted her ankle, fell to the ground in pain. Her ankle swelled up like a balloon. Ref ran out onto the field. The coach ran on the field. Even her mom ran on the field. They feared her ankle was broken. They carried her to the car. They took her to your emergency room. At the same time, Alvin came in. Alvin has COVID. Oh, poor Alvin. Thinks he's going to die. COVID killed so many people. He called his doc. He said, "Doc, I took a home test. I had a fever. I have chills. I tested positive. What should I do?" They said, "You need to get the monoclonal antibodies. They work." So they sent him to your ED. At that time, Paul comes in. Paul suffers from sciatica. He's had it for years. He was at home. He got up, twisted his back. Maybe he doesn't even know what happened, but the pain was so tense, so severe to his lower back. Same pain he had before. He went to his medicine cabinet to get one of his pills. He had none left. He called his doctor for a refill. His doctor was not in. So he got the service. The service told him, go to the hospital. Get a quick pain medication. Come see us the next day. So he did just that. Came to the emergency room in such intense pain. These 3 patients were fast track patients. They came into your fast track area emergency department. They waited and they waited. There was no nurse to see them. There was no doctor to see them. Staffing shortages in the emergency departments today are severe. Nursing shortages are severe, as well as physician-provider shortages. They're severe as well. The COVID-19 pandemic has taken its toll on the emergency room. Burnout rate is severe. Retention rate is very low. And hospital turnover rate is extremely high. We are having major problems today with staffing the emergency department with quality providers, both nursing providers and physician providers. So what's the solution? We have to do something. There can't be nobody to treat these patients. Nurses, doctors are so overwhelmed right now. Their workflow is so severe. There's so much they need to do, and they don't have the staff for it. So solution, let's hire NPs to the ED. So my first message about this is NPs improve ED quality and they improve patient outcomes. NPs increase efficiency, they increase timeliness, and they improve quality metrics. So one of the things that I do as a director of nursing is I have to report on my quality metrics. My sepsis bundle rates. Antibiotics have to be given within 90 minutes of arrival after diagnosis of sepsis. Patients have to receive those antibiotics. They have to receive vasopressor support if their blood pressures are low. Door to EKG time is also a metric I report on. But you know who can order those antibiotics for the sepsis patient? That's right, your EDNP. Do you know who can read those EKGs? Identify a STEMI as quick as you would ever know? Your friendly EDNP. A patient comes in with stroke-like symptoms. What do they need? They need to get a CAT scan. Do you know who can order the CAT scan? That's right, your EDNP. They can take the care for these patients away from the MDs, away from the nurses, and they can provide this care. MPs provide a holistic approach to medicine that an MD cannot do. NPs also improve patient satisfaction. Yep, that's right. Patients can choose where to go. Hospitals are rated by Leapfrog on an A to a D rating. And they pick. Just like you look up a restaurant before you go to there to eat there, patients are looking up to hospitals. Would you want to go to a D-rated facility if there's an A-rated facility around the corner? Of course not. It is proven that NPs improve patient satisfaction. Another statistic that I like to report on, NPs also had a 21% fewer death rate after procedures were done in the emergency department. That's huge for quality. Patients want to know that. Patients love knowing that. Patients also who are covered under Medicaid have a 5% lower Medicare costs per beneficiary. That's huge for their satisfaction. Another interesting statistics, patients were asked when they were treated by NPs versus when they were treated by just MDs. Patients reported better perceptions of clinical quality when treated by an NP. Another resource that an NP can provide is education. Right now, because the physicians are just so overworked and so busy, same with the nurses, patients get their discharge instructions from the ED. A quick 2-minute discussion. Everybody is rushed. Patient leaves. An NP can provide discharge instructions to patients. And because of this, patients are more confident that they would care for themselves properly after discharge when being treated by an NP. These facts are enormous. Second message I want to discuss is barriers to using NPs in the ED. Yes, and there are barriers. We have to face that. We have to know what our barriers are. Our major barrier is physician-related issues. The American Medical Association is against using NPs, specifically in the emergency department. They are afraid NPs will take jobs away from MDs. That is not true, but that is definitely one of the huge barriers. Payer policies is also another barrier to using NPs in ED. Insurances pay less when the patients are treated by an NP. This affects the hospital's bottom line. Also, getting hospital senior leadership on board to the idea of using NPs in the ED is a major barrier. As we know, most hospitals are run by either the chief medical officer, who's an MD, or the president, who is also usually an MD. Board of directors usually made up of MDs. Very rare are these positions made up of RNs. The physicians are not on board yet to using NPs, even though evidence clearly states quality of care is improved when NPs are used. So how do we get around this? Why should we use NPs? NPs will help the ED. NPs will increase ratio of patient to provider. NPs cost less than an MD for the institution. NPs provide education to patients that they're not getting right now. NPs can work in the fast track area. NPs can work in the triage area. NPs can work in any area of the emergency department. There are specialty NPs who can even work in mental health emergency department, in CPEPs. They can work. We know the mental health crisis that we have today. And who's better to treat these patients than an NP? The NP holistic approach to care is fantastic. We need to overcome our barriers. We need to get the MDs on board to this. We need them to know that the NP is not taking jobs away from the MD. That's just not happening. But what's happening is they're working in collaboration with the MD to reach the patient and result in positive patient outcomes. We need hospital leadership to get on board to the process of using NPs in the ED. We need them to see how your satisfaction rates will improve, your metrics will get better, your left without being seen numbers will go down. I can go on and on about all the information, about all the statistics, all the facts that prove NPs work. So in my emergency department, I plan on using NPs. We currently contract out to a physician provider organization to provide emergency services, and they use PAs. What I want to do is hire our own NPs to work in the ED. I will use these NPs every day. They will be on every shift. They will supplement the care our patients receive. Our patients will receive a holistic approach to medicine that has not been seen. I'm going to convince hospital leadership by showing them that NPs work. I need to increase our patient satisfaction scores. NPs will do that. That is a way I will prove to hospital leadership that using an NP is the way to go. By using NPs in ED, we will change how NPs are used throughout the hospital setting. NPs currently are not being used where I work. When I start using them in ED, and we are successful using them in ED, NPs can now be used in the infusion center. NPs can be used in employee health. NPs can be used in the perioperative area. Nurse anesthetists can be used. Currently, they're not using nurse anesthetists. Nurse midwives in mother baby units. You can put an NP in basically any area of the hospital, and you will see improved patient care. So thank you very much for listening to my presentation, my TED Talk, and I hope to see all you future NPs working in my ED. Thank you very much. Have a nice day.